So if you come look at this here, the red and the green here are your two different hips, right? So if you look at this trend, you can see
higher amplitude.
Right, so you can see that generally speaking, all these peaks down here, I mean, obviously we want symmetrical hips, right? So you can see that these green peaks sit lower than these red peaks, right? So your left hip is compensating by just living in some forward flexion, right? The range of motion is similar left to right, like your functional range of motion, but your right hip is using more of its hip flexion and less of its extension to go through its motion. Does that make sense? That hip is flexing more to give you a degree of extension that you do have. Okay? So the same amount of extension is still required. What you're just doing is you're just living in more relative flexion so you can extend easily. Okay? So ideally we would want these two things to be more symmetrical when we test them. But you see how like that's yellow and those two lines are your left and right leg and they're in front of the yellow, right? So that means that your step length is short on this side relative to like what's normal for your population. Your load symmetry is not bad, but you're walking really slow. So as you walk faster, we would expect this to increase. As you currently sit right now, we would obviously want that to be close to 0. Again, we talked about that high variance of your steps, right? We want that to be standardized, and then so sometimes you'll take a 24-inch step, sometimes you'll take a 22, sometimes a 26, and then contact time. So these should be basically the same. If it's not the same, that means there's something there. Yeah.